professional, you start your activities in inquiring about the patient, from the patient or from the patient's relatives. Communication is the system with which you keep on informing the patient or the patient's relatives about the progress. Communication is the system by which you communicate with the colleagues with whom you are working. Communication is the system with which you communicate with your elders and superiors to get better results, better facilities. Incidentally, it's through practice, through individual brilliance, people develop this art, and that is what makes the difference between an excellent doctor and a not so excellent doctor. A doctor who communicates with his patients in an exceptional manner stands out. He may have cultivated that quality himself. That is where I think as academicians of this institution, my senior and learned colleagues can give a little thought to their students during their postgraduate courses. Communication with the patient is important. It is equally important how you communicate with your team. And that communication has to be continuous, without any break. Any communication failure can result in a lot of difficulties, and at times, which we really don't want, is absolutely adverse situations due to failure in communication. Second is equally important, again what I have been stressing, cohesion among the group. We often hear about adverse situations created in institutions. And there's a common saying that a medical professional's worst enemy is another medical professional. I'm sure all of you who are senior and who are not so senior might have had the opportunity to see this in their course of professional life. This is very important as far as your group is concerned. If you can ensure that spirit of cohesion, that unity inside your group, you can be confident of working with a lot of excellence and give the best output. Cohesion is a word which means a lot. It is not just physical cohesion, it's a cohesion of the thought process, a cohesion where you think twice before you talk ill about your colleague. That is once again cohesion. To ensure that cohesion, that spirit has to be inculcated in each and every member of the team, so that while you are working, you develop a spirit, you see something wrong, you try to correct it yourself or with the help of your teammates. That is cohesion, where you don't go out and project that wrong to outsiders. It is where you look inside, look into your friends, yourselves, get it corrected so that there is no adversity at all. As a leader, all of us have another very important responsibility, and that is evaluating the progress of the individual and the group. This, ours is a postgraduate teaching institution, and all our esteemed teachers have this important responsibility in evaluating the progress on possibly a day-to-day or even a weekly basis, because once you evaluate the progress, you also start taking those corrective measures by which you can ensure a steady level of progress. It is those units which have a constant monitoring. And mind you, this evaluation should be in such a manner that it's a constructive evaluation, which supports the further progress of the individual. Evaluation of the group is also important where you are working in a unit. The day 1, the assistance of your team, and day 21, the assistance of your team can give you the impression of how your team has been functioning within the last 3 weeks. That is the assessment which can give you the idea where you have to stress, where you have to guide, where you have to support to get the results that you want. The other one is, of course, self-explanatory. At every step in life, right from the time we understand our elders' language, as human beings, we always seek some reward, some encouragement. Small example, all those who have children or people like me who have grandchildren, there's a very common utterance by the youngsters, the small kids. When you ask them to do their homework, the first question they ask you back is, what do I get for it? Even doing their routine homework, a child of 3 years, the first question is, क्या मिलेगा? Homework तो करूँगा, पर मुझे क्या मिलेगा? So that reward feeling is inculcated right from childhood. And let us not be mistaken, as we grow up, we don't lose that quality of ours. Even in our day-to-day work, a small little word of praise definitely helps an individual to function better. And the encouragement and reward, it need not be $1 million reward. It could be a qualitative reward. It could be a chance the next time as the first assistant, or chance the next time as doing the surgery yourself. That could be the best reward that a surgeon aspires for. So the word of encouragement and the reward is equally important as a team leader. You can have the reward in the form of your senior giving you the opportunity of introducing the new unit to the DGRHS. That is another reward. And getting photographed in 15 or 16 newspapers all across the city. That is a reward. I don't know how many of you have seen the inauguration of the ophthalmology OT. Photographs have come in umpteen newspapers across the city. And that was a inadvertent reward to the junior member of the department of getting photographed and splashed across the city. She did a wonderful job while introducing the DGRHS. That is the confidence that the leader has in the team member. And once you are given that opportunity, that acts as a reward and as an encouragement. The last is very important. Of course, here one thing has to be exercised, and that is you have to be subtle, you have to be diplomatic, you have to be polite. Feedbacks on performance, you take it in a very, in a very soft manner, not going out around interrogating people and finding out what is being done, what a person has done. But you have to collect your feedback as a leader of the unit. This is something where I think we have a lot to do, because as a unit, the wards are one of the most important aspects of a hospital function. And that is where, as the leader of the team, all of us have the responsibility of getting the feedback. Certain hospitals have got feedback forms which reflect on the performance of the hospital staff, the hospital services. Here we have not been able to start that feedback form, and the compliance of filling up feedback forms and submitting is also not very positive. But as the members who are working in the wards, I think we can definitely get feedbacks from the beneficiaries, that is the patients. I do not know how many of us are doing it. As a routine measure, while we are discharging our patients, I don't think we have the time to ask them, how was the nursing services? How was the diet? What was the behavior of the staff while you were here? That is a feedback which reflects on the services that are provided by our team. As a team leader, it is essential for us to know actually the assumptions under which we work, whether they are actually true or there is some amount of lack of success in them. I won't say failure, it sounds very bad. That is how you get your feedback. And then the most important part comes is counseling. Once you have found out that there are certain things which are not what you would have desired to be, there are certain things which the beneficiaries feel should have been better, that is when your role as a counselor comes in. And that is where you have to use the skills which have not been taught in our medical colleges. That is your communication skills and your skills of convincing and persuasion in the most acceptable manner, I should say, to the members of the team. It could be your cleaner, it could be your attendant, it could be your dresser, it could be your nursing sister. Any of these members of the team might have to be counseled in the language they understand, in the language they accept. The most important, stated simply, but carries a lot of weight along with it. As the leader of the team, the responsibility lies on the leader to get the job done. How you do it, it's your doing. That's what the system desires. And along with it, what I have been stressing is the cohesion of keeping the group together. While you're working, you develop this quality while you're working in the team as a member of the team, and you move, as you move up from being a member to becoming a leader of the team, you gradually develop this quality of how to keep the team together. A very important quality. The leader should be honest. He should display his sincerity, his integrity, and candor in all his actions or her actions, because any deceptive behavior will make you lose the trust that your team has in you. It takes a lot of time to build up a trust, but to lose it takes a few seconds if you are found to be deceptive. Of course, all of you are competent. As team leaders, once again, you have to prove your competence to gain the confidence of your team members. Your actions have to be based on reason, and as has been mentioned earlier, on moral principles. This, of course, no one does nowadays. No one makes decisions based on emotional desires or feelings. If at any point of time this does tend to happen, you have to give deep thought to it, decide what is rational, and take the decisions. Further, we are very aware with this aspect. We always keep on talking about it. Vision 2020, Vision 2025. So,